I'm Dr. Bryan Gawley, and I practice plastic surgery in Scottsdale, Arizona. My practice primarily deals with cosmetic plastic surgery as well as breast reconstruction. My training is in both plastic and reconstructive plastic surgery, which encompasses cosmetic surgery, which most people are really familiar with, but also reconstructive surgery of the breast, the body, the face, the hand, cleft lip, cleft palate surgery. So it's a pretty broad-based specialty. After being in practice for 8 years, my specialty has really become mostly cosmetic surgery. I've been in practice for 8 years. I did my undergraduate training at the University of Arizona in Tucson, and then I did medical school in Tucson, and then I did my training in both general and plastic surgery at the University of Texas, Galveston. And after 5 years of training in both of those specialties, I became board certified by the American Board of Plastic Surgery, and I moved back to Scottsdale, Arizona, where I set up my practice. A lot of my practice is cosmetic surgery. I would say 60% of the surgeries I do involve the breast and the body, so breast augmentation, breast lift, and breast reductions. The proverbial mommy makeover, which is essentially an operation to rejuvenate women after post-pregnancy. Usually involves a tummy tuck and breast implants or a breast lift, sometimes some liposuction. Facial rejuvenation is a good component of my practice as well. My personal preference with facial rejuvenation is to create a natural appearance, and that involves, an individualized approach to every patient. Every patient ages in a different way. The breast reconstruction patient is very rewarding for me to be a part of their transformation. These patients get a diagnosis of breast cancer, and with that usually comes kind of a social condemnation of sorts, and to have them come to the office and see that transformation where they all of a sudden realize that the sky is not falling, and that there's hope, and that we can actually create results after a mastectomy that in some cases are even better than before. And that's pretty amazing to see that transformation in a patient who's given that diagnosis, and then a few months later comes back and there's a smile on their face, and that's something that I'm really proud to be a part of.